Hi everyone, my name is Lily Lau and I'm an undergrad student at UCI, and I had the pleasure of working with Dr. Powell and his research team on assessing global disparities for localized renal cell carcinoma clinical trials within the United States. Just for some background information, clinical trials are a crucial part for cancer care for patients, correct? So we asked the direct question of whether counties with greater social vulnerability are systematically left out of renal cell carcinoma localized trials. For the interest of time, I'm going to skip over the methods, but if there's any questions pertaining to how we were able to gather all of this data, my email is right here in the bottom corner, and you're free to, give me a shout or an email with any questions. So, in terms of the data itself, if I could direct your attention to Figure 1. Figure 1 is actually a really great representation of where these localized RCC clinical trials are across the U.S. according to the counties they're specifically in. So you can see more specifically along the coastlines, it's a lot more green. So the green represents counties with higher trial counts. And specifically in the Midwest, I would say there's a lot more yellow, where we see 1 to 0 clinical trials within those specific counties, right? And I think the main takeaway from Figure 1 is that across 3,145 U.S. counties, only 384 counties hosted at least one localized RCC clinical trial. So that's about 12%. And I think that's a really scary number, but I think it also raises an important question of who's living in these higher social vulnerability communities. And I think that question can be answered really well with Table 2. Table 2 is a representation of us comparing low social vulnerable communities to high social vulnerable communities, assuming that the community size of both communities is the same. So it gives us the ability to really just hone in on the differences between trial count and the SVI. So as you can see, if we compare the SVI of a low social vulnerable community with a high social vulnerable community, it has a 1.83%, or at 83% more likely to have a clinical trial. So to break it down, basically, what all these numbers mean is that counties with lower social vulnerability consistently have greater clinical trial availability than counties with higher social vulnerability. That is a lot of information, with all the numbers and the information. So just to break it down very simply, people who live in higher social vulnerable communities are having the, least amount of access to these clinical trials, which is very important to know. Finally, if we look at Figure 2, Figure 2 is a great representation of where we can identify these social vulnerable communities. So you can see mainly where the purple is, that is where we're gonna see our high social vulnerable communities, whereas yellow counties or anything green and blue would represent low social vulnerable communities. And so we can really use Figure 2 in comparison to Figure 1 and see how those two contradict each other. Finally, for conclusions, if I could have you guys walk away with one important note from everything that we've talked about thus far, I'd like you guys to know that nearly 88% of U.S. counties lack clinical trial sites within the U.S. And I know that's a really scary number, but I wanted to add on by saying that a lot of these counties that are lacking trial sites aren't by random. They're the same counties that have the greatest social and economic burden and are oftentimes the patients who need these innovative treatment options but aren't having the access to be a part of them, right? So in terms of future directions, I would love to see, honestly, a lot more advertisement for these clinical trials instead of seeing, you know, advertisements for different drug companies, more like advertisements for clinical trials. That's where I would love to see this information go, even to go further into seeing if physicians and researchers expand to, you know, their colleagues and friends when it comes to the specific trials that they're participating in, and really reaching out to these high social vulnerable communities to expand their studies and make sure that everyone has equal access to these clinical trials. Other than that, that is the poster entirely. If there's any other questions you have about the poster, my email right here is at the bottom, and it is lilyml@uci.edu, and you guys could give me an email and I'd be more than happy to answer any questions pertaining to the poster. But thank you so much for listening.